Implant size. That seems like the biggest decision that every patient wants. How big should I be? Should I be a B, a C, a D? And that's something that patients dwell on more than anything else. Well, let me reduce it all for you to one question. Do you want your breasts to look relatively natural, or do you want them to look augmented? It's that simple. Your breast has a specific capacity, just like a purse or a duffel bag. If you shove more into that than the width, the depth, and the height will hold, it starts to look round, stuffed, coconut. You start to see the edges of it. And that just is what it is. So when I see a woman who says, I want to be natural, and I want to be a D, but she's flat as a board, well, there just isn't the skin there for me to put that big of an implant in and get it to be as big as a D, but without it looking like a coconut or a grapefruit. So the answer that you have to come up with is, if you want to basically look natural, have your surgeon take the appropriate measurements and tell you what fits in your breast, and just accept that as the ideal size for you. The ideal size will fill your breast up so that it's the most proportional and the most beautiful. You go beyond that, it'll start to look stuffed in the short term. And in the long term, that extra pressure of the bigger implant, it will stretch your skin, and the pressure of the implant, just like a sofa leg on the carpeting, will slowly compress and thin your breast tissue. So pick the implant that's of the right size. And of course, if you go too small, then the breast is not adequately filled. The upper part of the breast could be empty, and you're not augmenting proportionally the whole width of the breast if you just have a narrow implant. So make your pick. Either arbitrarily choose a size, regardless of how that implant fits within your breast, or have the surgeon take the measurements and come up with the implant that fills and creates the most beautiful breast on your body.